I would like to introduce our amazing speaker to you. We are very pleased to be working again with Dr. Asa Radix. Dr. Radix is the Executive VP of Research and Education at Kellen Lord Community Health Center in New York and Clinical Professor of Medicine at NYU Grossman School of Medicine. They have extensive experience in providing care to trans and gender diverse people and have contributed to national and international guidelines on trans healthcare, including as co-chair of the WPATH Standards of Care. Their research focuses on HIV prevention and healthcare access and outcomes for trans and gender diverse people. Over to you, Asa.
Okay, so welcome everybody. Are you able to hear me and see my screen? I hope so. Please say yes. Is that a yes? Okay, good. So great. So yes, today we're on part two. What happens after you get the acceptance? And I wanted to first review what we're going to cover today. So we have one slide that's just going to cover some key points from the webinar we did last time. Then we're going to really be talking about transforming your accepted abstracts into poster presentations. We're going to talk a little bit about design, accessibility, and delivery techniques, and then a little on oral presentations and just covering some overall tips and common mistakes that people make. And of course, there'll be plenty of time for a Q&A because I didn't put a lot of, I didn't have as many slides today. So just, tips from part one. We covered that preparation is key to success in abstract writing, that you want to ensure your abstract is complete, concise, clear, and cohesive. We discussed a lot about writing plainly and avoiding jargon and had examples of good abstracts and maybe abstracts that weren't so good. Thinking about aligning your abstract with the conference themes. Always remember to grammar and spell check and, just the logistics of word count and formatting to make sure you follow those exactly, because sometimes a really good abstract might be rejected just for these, some technical issues. And, that's obviously very disappointing, like going over the word count, for example. So, you've done all the hard work that we covered last time, and you get the letter, and it says your abstract has been accepted. What do you have to do next? I'm going to show you an example, but the first thing, of course, is to read the abstract email very carefully before you do anything else. You want to, first of all, check like what kind of format you've been accepted for. Sometimes it's a poster, sometimes it's an oral presentation. Obviously, the date, the time, and the poster number, if it's a poster or oral presentation. If they might send you a template to follow for the, if it's a PowerPoint presentation or for the poster. And I'll say that, there are a lot of problems that start by forgetting to confirm acceptance, because usually what they say is you have an acceptance, please confirm that you're going to present, and people forget to do that, and then the abstract is withdrawn. Also, there might be necessary formatting requirements. You might have to register for the conference, and if you don't register by a certain date, they might withdraw the acceptance. So that's why the acceptance letter is so important. I just showed you an acceptance letter that I got for last year, the AIDS 2024. Now, sometimes it doesn't start with congratulations. Sometimes it starts with, we received a lot of, really good abstracts, and unfortunately, you didn't get accepted. But this was a good one. Congratulations. So it gave the abstract submission number, it gave the title, obviously important if you had more than one thing submitted, the date of the presentation, the time of the presentation, where it's going to be. Why is this important? I remember the first abstract that I ever had accepted at, an AIDS conference. I just assumed it was a poster, and it was actually an oral. And I didn't realize until really late before the meeting. So, so I'm just telling you about lessons that I learned, and it tells you a little bit about the expectations that you're requested to stand next to your poster on the date of presentation and present your work. So we'll just move on from here. So I wanted to start with, what are presentation types? Because that might not be clear to everyone. The first is a poster. So this is when, you're asked to put your abstract on like a large piece of paper or poster board and hang it up. And then you stand next to it. The oral presentation is, obviously there are, you have a PowerPoint, and a plenary is, and then you're usually with a group grouped in a session. So each person gets to present usually for like 15 minutes. And a plenary is usually like 30 minutes to an hour. I have a great picture here of Jay from Uganda who gave a plenary presentation last year. And that is the hardest one actually to get invited to or to get accepted. So again, what is a poster? So it's a visual summary of your program, project, or evaluation. It is designed to share key messages quickly and clearly. Your goal is to engage the audience. You want to make it stand out, so people stop in front of your poster. So not so many words, but tables, graphs, pictures. It really is a tool for conversation. People will stop and, talk to you. It's an opportunity to network. People have got jobs, from standing in front of their posters. So, it is really important and necessary to be there. You usually get a time slot, as you saw from my, the acceptance letter I put, usually 1 to 2 hours during the conference where they say, please stand stand in front of your poster. You're going to set the poster up ahead of time, usually early in the morning. And then again, the idea is that you're going to present your findings. So people will come up and ask you about the poster. It's really, really important. I've seen this again and again. Confirm the size and orientation of your poster. I have never been to a conference where someone like didn't arrive like with the wrong poster orientation and it does not fit on the poster board. So really, really important. So just to review, some posters are landscape or horizontal. So they are wider than they are tall, right? They're landscape or horizontal. And then so that's like WPATH usually uses horizontal posters, or some are vertical. So they're long, they're, up and down is long, and they're not that wide. So that's a portrait or a vertical poster. These are the ones that are used by, like the AIDS conference, IAS generally uses vertical posters. CROI is another one that uses horizontal posters. But again, you cannot predict, and they could change their rules at any minute. So make sure you read all the follow-up emails about the poster. Again, I've often seen people with horizontal posters and trying to fit them on a, vertical or portrait board. And I'm always like so grateful that that wasn't me making the mistake. Don't let it be you. So the next step is engaging your audience. You've had an accepted abstract. So, use that as your template. So if it was, title, methods, results, conclusion, and I put results of the star of the poster, then when you set up your poster, make sure you use those sections, like those subheadings. You want to answer 3 main questions. What is the most important finding from my research project? And you want to highlight that. So you could highlight that by having it in like a larger font or a background that's like a different color or something that I'll show you, often like just summarizing the key important findings in a big text box in the middle of the poster is very popular these days. But you want to ask, how can I visually share my research with conference attendees? And really think about how you want to do that. Is it with charts, again, graphs, photos, or images? You want to capture their attention. You always want to have the really cool poster that everyone wants to stand in front of. So obviously there are a few basic things around layout and design. And I should say, my first poster was terrible, right? So I had way too many words on it. It was all scrunched together. It wasn't interesting. Don't be me. in those days, right? You want to have a logical flow. Usually the words would go from left to right and like top to bottom. You want to, I'll show you some posters, but you want to leave a lot of white space. You want to make sure the title is readable from 10 feet away because, people are walking past your poster and they're not, yeah, they have to squint. They're not going to see the title. And again, I'll be saying this again and again, but figures and photos are more engaging than text. A little bit about visuals and color. There are some best practices, for example, using a light background and dark text. For subheadings, you might use, a dark background and a lighter text, but the most important thing is the contrast, right? You want high contrast colors, really high quality charts, icons, and graphics. Like you don't want things to look pixelated. And we'll talk about printing later on. The other thing is accessibility. So you'll see folks who might do a graph and they'll use like a bar graph and they'll use red and green. Now that's not accessible to someone who's got red-green color blindness, right? So do think about accessibility when you're choosing the colors for your graphics. We don't want to leave anyone out. We want everyone to be able to participate and to learn something from our project. So I just chose this. This was actually a student who put together this poster, and it was for a meeting in Canada. It was an HIV meeting. And I actually really like this because there's a lot of white space. There's not too much language. I mean, I think maybe the font could have been a little bit bigger, but what I liked about it was that, the title was very clear. And again, there was a lot of white space and it looked, it was three columns. The subheadings were very clear and it had some color in. And yeah, and I was like, what's that person climbing those steps? What is that about? So, uh, I just picked this off the internet as one I liked. The main thing, of course, I think one of the biggest mistakes that I see on posters is that people try to put too much on the poster, and as a result, the font is very small. And again, you want to be able to read clearly from 10 feet the title, and you shouldn't be too far away to be able to read the poster. So you do want to make sure that you are using large size text, right? So this is like best practices, the title of 90 to 120 points, the section headers anywhere from 40 to 72, the body text 28 to 36, and line spacing enough that, you can separate visually the sentences. To avoid, you don't want to put too much text. You don't want to just copy the abstract and like put it. Otherwise, why would people come? They can just read the abstract in the abstract book, right? You don't want to use all capitals for the body text. That looks a bit rude, actually, even though I know people do it. The best practices is not to do that. You don't want to use fonts that are too small, and definitely you don't want to use tiny tables or unreadable figures or tables that aren't labeled properly. Um, I would say, don't do those things. There are also some best practices around like what fonts should you use? I mean, there are many fonts. If you go into Word or, PowerPoint, like what are the fonts? The idea is for headlines, like section, the titles, the poster title, um, subheadings, you want to use bold fonts, again, that are readable from a distance of 6 to 10 feet. I've just given two, like Arial Bold and Franklin Gothic, are two that are frequently used. You can use like two different fonts in your poster. Like you can use one font for the title and the major headings, and then for the text, you can use a different one. Some examples of best body text fonts would be Source Sans and Calibri. What you do want to avoid are the serif fonts, and that would include like Times New Roman, because those are actually very hard to read. They're not as accessible also for people who have um, issues with, visual accessibility issues. It's not, it's not an accessible font. So Arial, Calibri, try and stick to the ones that are thought to be a easier font for people with vision problems. I just put this up. I actually tried to think of like what would be, this is not a real poster, but like what would be a really ugly poster. And I think you can see this is not a great poster. There's not a lot of contrast in the title with this like dark writing on dark red. I'm sitting right in front of my computer and I can barely read the names of the authors. If you look at the subheadings, the font is really small and it's like a light text on a fairly light subheading. You can't even really read the one that says results. You can see how the person who designed this poster put as many words as possible in the different sections. Like you can't read this from 6 to 10 feet away. I put in a table with teeny, teeny writing. Don't do that. Um, and the figures are, yeah, red, green figures again. Avoid that for the bar chart. And yeah, I mean, if you could see it, you would see that these graphics are terrible. And then there are a whole lot of um, logos that just are stamped on there. And there's like, the red flag, the ribbon, like why is that even there? The idea is not to just decorate your abstract with lots of ribbons. It's not okay. So I just wanted to show you, like, if you might think this is over the top a bit, but when you go to the conferences and look at abstracts, I guarantee you're going to see something like this. Lots, too much text, tiny fonts, tables that are too tiny that you need a magnifying glass. Don't do this. So, what are some of the other things to know? Remember, I said that results are really the star of the poster. You want to keep it simple though, right? Again, you can use counts, percentages, trends. You can, these should be in the abstract pre-post comparisons, service uptake or retention, but you want to find a way for these results to really stand out on your poster. What I'll say is for a lot of CBOs that are doing projects that are based on programming, you have such rich data, and often there's qualitative data. It's hard to put like a lot of quotes into the abstract that got accepted because of the word count. But now you have an entire poster or, hopefully a PowerPoint presentation, oral presentation that you can really include some of these short quotes, client or staff reflections. If you have community advisory board, you can put input. And I'll say this is a great quote, but a single quote can be as powerful as a p-value. And I just put two here from posters that looked at, the importance of providing gender affirming care to people who are accessing, sexual health and reproductive health services. You see, when my provider used my name and pronouns, it changed the entire experience of healthcare for me. Providing care for trans people isn't about special treatment. It's about delivering competent, respectful healthcare to every patient. And that was a quote from a healthcare worker. Again, you can have all the numbers and all the statistics and, showing how you're programming. This was about, providing sensitivity training to clinicians in health centers. Like you can have all of that, but don't the quotes actually tell you so much more about what the healthcare providers learned and what the patients felt about having this rolled out? So again, if you can include those in your poster, it really is meaningful. What about visual identity? It is important, you're coming from a CBO, you have a logo. Obviously, you want to include that. Maybe there's some colors that are that your organization is affiliated with or uses. Like it would be, it's nice to include those, like brand colors. Um, I put community forward visuals. There's a tendency, unfortunately, when people create posters, and I'm not talking about CBOs, but a lot of people, I'll say who aren't trans, will use like the same picture of a trans person that they found on Google holding a trans flag, and this is on every poster, and I'm like, why don't they actually use photos from their organizations, obviously with permission, or people who've been, have agreed to be on the poster, right? It's so much more authentic than just looking at stock photos. So sometimes it's not possible for safety reasons, for particular countries or organizations to actually use images of, clients, even if the clients have agreed. But there are some collections, and I put this on the Gender Spectrum collection, is actually from the US, that was organized by trans people, and it has images of trans and non-binary folks who were, paid and compensated for their time and have agreed for these photos to be used like on educational material. So we use them a lot. So it's genderspectrum.vice.com. That's just something for when I say community forward visuals, we really want to make sure that our communities are represented in the right way. So I put this is actually a poster that was accepted at IAS earlier this year from my organization. It was looking at testosterone effects on sexual health in trans men. And you can see here that a lot of the poster was, we had a picture. I didn't put the whole thing on, but this was a picture of, someone coming in for care, drew people to the poster because they wanted to know, like, what is this? And what we did is, we went to the background, the methods, the results and the conclusion, but we also put a box right at the front that gave the key results of our study. So that if the only thing you did was look at the title and look at the key points, then you kind of understood what the poster said. And it was just basically that trans men who received testosterone had a low lactobacillus count, and that if they took an oral probiotic, that it improved their vaginal health. So you didn't even need to read all the rest of the poster, but the key points. And again, this is like maybe over the last 5 years or so, where people have been encouraged to create a text box that just highlights their findings. And I think, that is a good, for us, it's been a good thing. It's made us think, like, what is like one sentence that we can use to draw people to the poster? So tools and templates, I wanted to talk a bit about that because people sometimes get a bit like, oh, I'm not a graphic designer. Like what, I don't know how to make the poster. Um, there are there are many tools that are out there, right? I'm going to talk a little bit about PowerPoint because I think so many people are familiar with PowerPoint. It's like most people have access, it's widely accepted, and you can actually create your poster in PowerPoint. There are some other options like Canva, which is, user-friendly, collaborative. The thing is, your organization might not have Canva. There's also some other tools I put here. We like you to use appropriate icons. And there are also poster templates in Mind the Graph, which you don't have to pay for. There's another tool, Vengage.com also has a lot of interesting icons on it. So, and I just put some examples here of like icons that you could use to add to your poster. Maybe, if it's about HIV testing, you could use an icon to kind of dress up your poster. I've also got the, like HIV test results. There's like HIV virus there. So yeah, you can get the icons. So you don't actually have to, um, you know, like draw it yourself. There are other ways to do this. I think it's again quite exciting that these tools are out there. So, where should you get poster templates? Sometimes the conference will provide a template and say, we want you to use this template and it's done, right? Otherwise, sometimes you can actually go online and there are free templates. So I put one here is the www.jennygraphics.com template. So you just have to choose the size. So it'll be like 36 by 48 or 24 by 36, that's in inches, but they also have them in centimeters. And you can, if once you know the size, you can put that in. Sometimes if you're affiliated with a university or your research was with a university, they might have a poster template. And again, I talked about some of the others, Canva, BioRender, and PowerPoint again, that I'll talk a little bit more about. So again, PowerPoint is familiar to most presenters. It handles large format posters well. It's easy to export to PDF, or you can save it as a PDF for printing, and you can do it offline. So if you don't know how to do this, really you want to open PowerPoint. You're going to go to Design, Slide Size, and Custom Slide. As you can see here, you pick Custom, and then you're going to put the width. So if your poster was 36 by 24, you'd put the 36 by 24. If it's landscape, you put landscape. If it's portrait, you put portrait. Once you've finished designing your poster in PowerPoint, again, you're going to save it as a PDF and you just give that to the printer and they will print it out, and it will print out in the size, the required size. It's not going to print out like a little piece of paper. So, and you'll hopefully have this presentation that you can come back to this on how to do it. After you create the PowerPoint or Canva or however you've done the poster, please do a spell check and have someone who's not on your team. Obviously, I hope everyone on the team will have looked at it, but have someone else take a look and just check it to make sure that it makes sense and that it's visually appealing. The nice thing about PowerPoint also is that it has a spell check. So it's always good to start off by printing out just like a letter size copy, like an A4 or 8 by 11 copy, just so you can kind of see what it will look like. And the other thing you can do is view it like on a wall or on a big screen so you can see what it's going to look like in real life. The other part that I wanted to talk about was printing, because this was definitely something that I wasn't aware of. I was there at the printer and all of a sudden the printer said, oh, like, do you want this in a matte finish, a semi-gloss, or a gloss? And I had no idea. I was like, oh, like, I think I was like, which one is the cheapest, right? Because our organization didn't have a lot of money. To be honest, the amount of money wasn't that different, but I didn't realize that if you choose like a gloss finish, it's actually very difficult to read in a conference setting because usually they have a lot of lights and there's a glare. It also means if you take a picture of your poster or someone else takes a picture of the poster, you get like a really bright light like on it. And it also gets like shows fingerprints really easily. So the recommended choice for printing is actually a matte finish, um, because it reduces the glare from overhead lighting. It's easier to read from different angles. So even if you're standing at the side, like you can see the letters on it, and it photographs really well, which is, you definitely want to have photos of your poster. Um, you know, for your organizational newsletter, like standing in front of the poster. So yeah, use matte, don't use gloss. Um, uh, it really is quite important. The other thing that I've learned in recent years is that, if you're lucky enough, wherever you take your poster to be printed may have an option of a cloth or canvas poster. So a really lightweight, it's not really cloth, it's actually vinyl. I should have corrected this, like a vinyl that you can wrap up in your luggage so you don't have to take like a poster in a poster tube. The number of people who have left their posters on the plane in the overhead, I can't tell you how many people have arrived and like, oh my goodness, I lost the poster, or I left it, I went through security and I forgot to take it after it was scanned through security. So I have, for the last few years, I've always printed on vinyl or cloth, put it into the luggage. It goes in with my clothes. I'm definitely not forgetting my clothes. And uh, it's, at the end of the conference, I roll it up and I bring it home. So if you can do that, it's helpful. So I just wanted to show you a picture. This is, I think it's actually IAS AIDS conference. So they're vertical posters, and you can see how many posters there are and how very, very busy it is. And it's just a reminder, always figure out where your poster is, because there may be multiple poster holes and you don't want to be running around trying to figure out where to put your poster up. Or this happened to me once, like getting to where my poster was supposed to be hung and someone else had put their poster there by mistake. Yeah, that was awkward. So what about the day of the poster presentation? It's important that you prepare like a 30-second pitch, right? Because people are going to be asking you about the poster and you want to like just have this really nice talk. So practice it ahead of time. So you can just in a nutshell, like say, like, this is my organization, this was what we decided to do, this is how we did it, these were the results, and this was our conclusion. Um, stand to the side of the posters so people can read it as they're walking past. The other thing I didn't know the first time I did this was like, what should I wear? Um, I mean, I would say be comfortable. So conference casual, comfortable shoes because you're going to be standing for a few hours. And bring some business cards because people might want to contact you later. Also, if you're stepping away from the poster, because usually the poster might be there all day, but you only have to stand there like 1 or 2 hours, is you can leave the business cards like you can make it like a little pocket and leave them next to the poster so that people can contact you if they're looking at the poster when you're not there. And what to avoid, very formal wear, there's no need for it really, or uncomfortable shoes. So what's the other thing? After you present your poster or while you're presenting poster, please get a photo. Like this is really memorable. I see this is from the Trans Health Summit in San Francisco, and someone had posted this online, and I thought it was it's such a great opportunity to highlight the work of your team. So yeah, these are always great pictures to post on social afterwards. So just to summarize, some common mistakes to avoid on the poster: too much text, font too small, just reproducing the abstract verbatim. There's no need for that. Um, Tiny figures and no labels on the figures, too many references, logos everywhere, and accessibility issues, right? So again, red, green, lack of contrast, or text and background not having that. So I wanted just to say a few words about oral presentations. Now, there are fewer abstracts accepted for oral presentations at most conferences, right? So you probably have a better chance of getting it accepted as a poster. Just remember when you put together your oral presentation, it's usually a PowerPoint presentation. On the title slide, it's good practice to have obviously the presentation title, your name, affiliation, your organizational logo, conference date, keep it simple and professional. Often they'll give you a conference template. So IAS, for example, gives you a conference template. WPATH doesn't. So um, you will have some options there. What is the biggest mistake that I see for oral presentations? It's the number of slides that people try to fit in. Okay, so this is real. Like you should be having one slide for every 1 to 1.5 minutes, right? So if you're told you have a 5-minute presentation, that's 3 to 4 slides. If it's a 10-minute presentation, that's 6 to 8, you know. I've had people, because uh, I'm on a fair number of like conference committees, and we'll say to someone, you've got like a 30-minute presentation. So that's like 18 to 22 slides. And they'll send me 90 slides. And it's like, there is no way you're going to get through this presentation. And it's not about, and then they'll say, oh no, I've done this before. It's like, if you're speaking that quickly, no one is going to be able to understand anything that you said. So, um, like I just put at the bottom, today's presentation has 38 slides for 60 minutes. Okay. So, which is exactly where it should be. So please pay attention to this. Really important. I've seen a lot of folks make mistakes. With your oral presentation, you want to engage with the audience, no more than 6 lines per slide, bullet points for key ideas, high quality visuals, graphs, images, and videos. Font size, as you can see, the body should be, 28 to 36, which is what I've used here. And, try to use uniform fonts. You don't want one slide in Arial, the next slide in Calibri, the next slide in something else. Like, try to just go through and make sure the fonts are the same. It's hard if you're taking slides from like different presentations you've given. They might, you just have to remember to uh, make sure the fonts are all in the same. So here's a don't do this slide. An example of a slide with way too much text. It includes every word that the presenter will say. People cannot read and listen at the same time. Sub-bullets are too small to read, especially for people in the back. And each bullet point has too many words. For example, I could have just written use fewer words, which would be 3 words instead of 24. You get the idea. You don't want to, and I borrowed this slide, and at the end, you can see for yourself how hard this slide is to read and digest with a busy background and 3 different colors for the various fonts. So don't do this. So remember, you want to summarize key takeaways in 2 to 3 points. It's good always to have a call to action or next steps, at the end of your presentation. Your contact info is really important because people want to get hold of you. They're really, really excited about what you had to say and they want to connect with you. And, they may not have a chance to kind of grab you at the end. So put it in. A closing message. Don't forget acknowledgement. So, your team members, because, generally you're the only one who's standing up there on stage. So you need to spread the joy and acknowledge everyone, especially the participants if it's a study, organizational partners, and definitely the funders. They're going to be looking for this. So we have left, 15 minutes for Q&A. Also, we can do Q&A from if there's anything that you're reflecting on from the first webinar, where we talked about how to, create the abstract. I think that would be important. Here are my details. And I'm going to go ahead and